97.9, 105.5, KISS FM. That's Liam Payne, Rita Ora, For You, 50 Shades Freed. In studio with me, I have Slocum Dickson Medical Group. It's the Slocum Dickson Medical Moment. And Adrian, what is going on? How are you today?
I'm good. How are you?
I'm doing great. You know, a little nervous with the snow coming.
Yeah, I was happy there isn't any snow yet.
Yeah, I know. Yeah, it didn't matter for this moment. And I was like,
just get to the radio station.
Right, I have it until 10 o'clock. SDMG.com. They have a Facebook. They have a Twitter. If you want to get into contact with them, you actually have new physicians taking patients, correct?
Yes, we're lucky to have new primary care that have just started. So recently, Dr. Syra Syed, she started the beginning of this week, and she's still taking new patients, of course. So, if you're looking for a primary care, go on our website. Dr. Vasali also started a few months ago, and he's primary care, internal medicine, and pediatrics, and he's taking patients as well. So SDMG.com, if you're looking for a primary care physician, it's very important to have one. So
it is. I just got my letter in the mail saying I have to make my appointment with Dr. LaFont. So I need to go make sure I get in because it's time to see my primary. But when it comes to hearts, it's Valentine's Day, but let's talk about the real heart inside of us. It's all about cardio, and can you introduce who you brought with you today?
Yeah, so February's Heart Month, so I have with us our cardiologist, Dr. Kumar, and he'll tell us how to keep our hearts healthy.
I love it. How are you doing this morning? Good morning.
Doing well. How are you?
I'm doing great. You know, I was just having a conversation about cardio and heart health with my mom, and I don't know a lot about it. I know you're supposed to work out or you're supposed to exercise your heart, but how often are you actually supposed to exercise your heart to keep it healthy?
So ideally, the recommendation would be 5 days a week.
5 days a week, okay.
At least a minimum of 30 minutes of cardio exercise.
30 minutes, okay, all right. So that's walking, running. Can it be just as calming as walking, or does it have to be a little bit more get the heart moving?
Yeah, you want to get the heart rates up.
Okay.
That's what
so fast-paced walking.
Yeah, like a fast-paced walking on a treadmill. You don't have to run fast.
Okay.
It could be a light jog.
Mm-hmm.
Anything that would cause the light sweat and elevation in your heart rate to a modest degree is what would be recommended.
Very cool. Okay, so let's talk about the most common kind of heart issue, the coronary artery disease. This is the most common one. Am I right on that?
Correct. It's the most common problem that we see in our society, and something that we want to increase awareness of.
Yeah, get right up close on that mic. Yeah, there you go. A little bit louder there. Okay, so what kind of symptoms kind of show you that you have this kind of disease?
So coronary artery disease is a condition where there is atherosclerosis or plaque buildup inside the arteries supplying the heart. So these are very, very important arteries that supply the blood flow to the heart muscle itself. The heart supplies blood to the entire body.
Yeah.
The heart also needs blood flow. So these arteries supply blood to the heart muscle itself.
Okay.
So inside these arteries, you could have plaque buildup, which is called atheroma in medical terms. So it's a combination of cholesterol with some smooth muscle cells, which grows inside these arteries. Interestingly, this process starts in the 20s. People don't realize that, and then it manifests after somebody is in the 40s. So, but this is a very slow process. That's why it's very critical to focus on lifestyle changes early in life. So when this causes significant narrowing of the arteries of the heart, it obstructs blood flow to the heart muscle. And that's what people feel as symptoms. Although the traditional classic symptom is severe substernal chest pressure or pain, what we describe as angina or angina.
Okay.
So that's not seen always in all people.
But if you do feel that sudden chest pain, is that an emergency? Should you be calling someone to help you? Or is it wait for an appointment? How do you handle that situation?
Yeah, if you're having severe, substernal chest pain, it is considered like an emergency because you don't want to take a chance with the heart. There are 100 different causes for chest pain, but this is the single most concerning cause. I tell my patients, you always want to be on the side of caution. You never want to take a chance. But it's interesting to know that not all people have these classic symptoms of coronary artery disease. There could be a wide variation in symptoms, and that's what we wanted to bring out a little bit, to educate you.
Which is big because I just turned 25 Monday. So I feel like now I've really got to start taking care of my heart, which is what's causing all the questions to come up, which is perfect timing because the heart run's coming up.
Right.
March 2nd, the heart run and walk is going down, and we're going to be at the start line. But what are you guys doing for Slocum Dickson?
Yeah, so we're always involved in the heart run and walk. So we'll have a team actually at the heart run and walk, and then the day before the expo that they do on the Friday, we'll be there and we'll have a table. So if you have more questions, you want to learn about our physicians, come get some free stuff.
Yes, I know. That's what the expo is good for, right?
That really draws people.
Yeah, it is. We have free stuff and good information to learn about how to keep you healthy. It's the Slocum Dickson Medical Moment, Slocum Dickson Dickson Medical Group, sdmg.com. Make sure you're getting in. There are new doctors taking new patients, and if you want to be a part of it, sdmg.com. Thank you so much for coming in today, and drive safe today, all right?
Thank you.
Bring the house down. More hits, more fun, more Listen It's Liz. Next on Kiss FM.